Hi, I'm Drew Hutchison. You're tuned to Local Bias. Today my guest is Jeff Trant, who is the Executive Director or Director at the Child Advocacy Center on Wisdom Way in Greenfield. Welcome to the show, Jeff.
Thank you, Drew.
I appreciate you coming on and sharing what is actually a really difficult issue, taking care of children that need help. So tell me about the Child Advocacy Center. How do you accomplish this?
Yeah, thank you, Drew. So the Children's Advocacy Center, or as we refer to it, kind of our shorthand is CAC.
Okay.
So we oftentimes refer to ourselves as the CAC. And we are a nonprofit organization that was founded in 2015, although our roots go back well further. But we opened our doors on Wisdom Way in Greenfield late 2015, early 2016. And we have a three-part mission. It's to provide help, hope, and healing for children who are victims of sexual abuse, serious physical abuse, and sexual exploitation.
Right.
And so we are a national accredited children's advocacy center. We're one of 12 in the Commonwealth of Massachusetts, and we provide some really specialized services to children who make disclosures that they're a victim of abuse and neglect, and that we also work with families, we work with schools, we work with our other partners throughout the community to help make sure that we can keep kids safe.
So there's, of course, this is one of those kind of hidden issues in some ways. It's not always readily apparent, but we know that this is a serious issue. Are you making progress in being able to, how you help the children? Like, are you getting better at knowing, oh, well, this treatment works better than this treatment? I mean, is there progress being made on that level? And then is there progress in being able to get the public to recognize the issue and how they can help?
Yeah, so first, we're sitting here talking about this today, Drew, right? So I think, the fact that we are having a conversation on GCTV to really bring awareness to this issue, which is far too often hidden and cloistered and secret, right? This is progress. Mm-hmm. So 1 in 4 girls, 1 in 6 boys is the national statistics, will be sexually abused before they turn the age of 18. Right, and so this is, when we talk about prevalence, this is the silent epidemic that far too many people are not talking about and don't know about. Right, so I want to talk a little bit about where we came from and why we're here. So back in the mid-1990s, so it was then Northwestern District Attorney Betsy Scheibel who brought the whole concept of a child advocacy center to the Northwestern District, which is both Hampshire, Franklin counties, and then the community of Athol within the North Quabbin region. And child welfare is a relatively new field, right? 1970s, mid-1970s into the 1980s is really when we saw kind of this standardization across the country with the passing of the Child Abuse Prevention and Treatment Act. So at that time, when a child made a disclosure that they were a victim of sexual abuse, right? This is in the first 10 years of when this child welfare formal system was existing, that kids make disclosures when they feel safe. And 9 out of 10 children are harmed by someone that they know and who has access to them in their home. And so children make disclosures typically at school. And in those early days, when a child would make a disclosure to a teacher, teachers care deeply about their students, and that teachers are not expecting nor equipped to receive that type of information. Mm-hmm. And so at the time, they would ask that child questions and clarifying questions because they wanted to understand what happened so that they could try to help them.
Right.
Well, what happened when they started to do that was they started to interview the child. So that teacher, right, became the first complaint witness from a legal perspective, right? They would start asking questions, and the way that you ask questions are different than the way I ask questions with my professional training. Right. And that the way we ask questions elicit different responses. So first the teacher would interview the child, then the teacher, out of concern, would then oftentimes bring the child down to an administrator, maybe to a vice principal or a principal, who would, with good intention, start asking the child the same questions. Right. So you've now created a condition where, based upon the way that those two adults ask questions, to create prior and consistent statements. And so it was not uncommon for a child to be interviewed, 2, 4, 10, 12, 15 times over the course of an investigation by different parties. So number one, it's re-traumatizing to have to recall the most horrific thing that has happened to you again and again and again. Also, if our goal of asking these questions is to get factual information so that we can either, pursue an arrest, pursue charges, right, to help keep kids safe, then ultimately we were having prosecutors that weren't able to hold perpetrators accountable in the courts because defense attorneys would essentially systematically dismantle, these disclosures because of the way to which we obtained the information.
It's possible to lead a child with your questioning so they give you the answer that they think that you want to hear.
Yeah, and so based on the age and developmental stage of the child, right, 100% true. You can, especially with a young child, right, who want to please their caregivers, right, they will tell you what they think you want to hear, right? So the way we ask questions matter. Also the location, right? So back in the early days, we'd interview the child at school, or perhaps Child Protective Services or law enforcement would interview the child in a police station or in another, what I refer to lovingly as a bureaucratic office space, right? And the implicit message there, when we're bringing a child who's a victim into a space where perpetrators go, the message is you did something wrong, right? So we weren't interviewing children in child-friendly environments. And so we weren't having good outcomes, both, in terms of holding perpetrators accountable, and we were re-victimizing and re-traumatizing children throughout that process. So of all places in the country, in Huntsville, Alabama, there was a prosecutor there who said, this is not okay. We need to think about doing this differently. And so they created what we now know as this best practice of child advocacy centers. And what this prosecutor said was, well, the detective who's investigating the alleged crime, the DCF, or kind of their equivalent social worker who's investigating the child abuse allegation, right, and me as a prosecutor, we all need relatively the same information. So rather than everyone having their siloed parallel processes, well, what if we all got together? Right? What if we had one single interview, and what if we trained someone in both a developmentally appropriate or in a forensically valid interview protocol, so we're not leading children, right? We're letting children disclose to us, right, in a supportive and non-directional way what happened. And what if we all got together and we watched the interview so that it happened once? And what if we did it in a child-friendly environment? So rather than bringing a child into the police department, what if we did it in a home? What if we did it in a place that was just made for a kid?
And that's what Wisdom Way represents.
And that's why we're on Wisdom Way, right? Is that it first and foremost is a house. It's a beautiful house. I argue that it has the best view in Greenfield, right, of overlooking all of downtown, and that is an environment where we have privacy, so children aren't walking down Main Street when they come in, right, and confidentiality is absolutely integral. But we really have created a space where children can come, yes, to be interviewed, but we do so much more than that. But in the early days, that's what they were doing down in Huntsville, and that there were district attorneys and prosecutors across the country who said, this makes sense, right? And DA Scheibel was one of those people who brought that to her jurisdiction in the mid-90s. Fast forward, right, to the late 90s, and we created what was the first Northwestern Children's Advocacy Center on the grounds of Smith Vocational School, right? And so that was a house. Rather than coming into the DA's office where you had this team of professionals who met with the child, they created an environment that was separate from the DA's office that, again, house, child-friendly environment. And that existed for a number of years. And shortly after District Attorney Sullivan was elected, one of the things that I appreciate about DA Sullivan is that, one, he cares deeply about children, and two, he's a really data-driven manager. And so he looked at the number of cases or referrals for prosecution for child sexual abuse that were coming into the DA's office, and there were a substantial number that were coming from Franklin County in the North Quabbin. And despite the fact that we have, kind of half the population of Hampshire County, right, we're seeing comparable numbers. And so to me, that speaks to the prevalence and the need in the community. And so DA Sullivan said, well, what about the family that lives in Orange and Athol? Or what about the family that lives in Irving or in Heath or Coleraine? To say to that family, come down to Northampton, well, you may as well say Timbuktu, right? It's not accessible, and it's not our community, right? And Greenfield is our county seat. And so DA Sullivan had challenged a group of board members who were serving on the Northwestern District, the Northwestern CACs, to really look at citing a CAC in Greenfield. And that's kind of how we came into existence on Wisdom Way. We were looking to kind of break away, if you will, from the Hampshire CAC. We were looking to found a location in Greenfield that was accessible, that was private, that was child-friendly, and that's when we came across 56 Wisdom Way. So we have been the beneficiaries of this amazing community that is Franklin County in the greater Greenfield area. I actually, before I became the executive director of the organization, had the privilege of serving as one of kind of the initial board members. So I've been involved really since day one that we opened our doors, and that we got Wisdom Way started with zero public money, and that it was really the contributions of the community who realized the significance and the need for a child advocacy center, and also the generosity of places like Wright Builders in Northampton, a gentleman who really is kind of one of our patron saints in a lot of ways, Mark Ledwell, who donated his firm's time to come and to help us rehabilitate the home to make it a place where children could feel safe and comfortable. So that's kind of what we've been doing since early 2016. That's when we opened our doors. That's when we saw our first child. And since that time, we've grown from an organization that hosted other agencies, right? So we partner with the Northwestern District Attorney's Office Child Protection Unit, right? So those are the prosecutors, those are the victim witness advocates, so those are the forensic interviewers that are really initiating the criminal investigation, right? So we're not part of them, right? But we host them. We also partner with 25 law enforcement agencies throughout Franklin County, the North Quabbin region, right? So we host them when there's a forensic interview, but we don't guide or direct them. And we also partner with the Department of Children and Families, who come on site for these interviews as well. So initially, that's what we did, right? The CAC was a building, and it was a space where all of these other multidisciplinary partners came to do their work. And really, over the course of the past 8 to 9 years, we've transformed ourselves into a really robust child welfare and behavioral health organization that's able to offer very specific and concrete services. And
these children are actually doing better after they have gone through this program.
Yeah, so let me say a few things.
Okay.
So number one, one of the goals of a CAC is that when we move forward with the prosecution, that we want to make sure that we are, that we're, kind of gathering information and that we're supporting the child, kind of throughout the prosecution. And that, as a separate entity, our advocates, our case managers, our therapists are able to work with the child completely separate from the criminal investigation and the prosecution. And so when a child is able to be supported throughout that process, there are better outcomes. Secondly, we also are providing direct services. So right now, I don't think it's any secret that we are in a mental health crisis, not only in this community, right, in this region, in this state, but in this country. The wait list for services is substantial, right? That we're anywhere between 26 and 52 weeks from when someone, starts the process of seeking outpatient mental health counseling to when they're actually able to begin ongoing treatment with a qualified provider. That's kind of the range of what we're seeing. And for kids that have experienced a trauma, you have a window of opportunity where we're able to engage and to be able to provide the right type of therapeutic intervention before we start to see more chronic kind of disabling disorders set in.
Well, I mean, it's because the people that commit abuses are often people that were abused when they were young. I mean, there's a cycle.
There is, and we see a tremendous amount of intergenerational transmission of trauma. And so another big part of our mission with providing help, hope, and healing is to help disrupt the cycle of abuse. So at the CAC now, we have a number of doctoral and master's level clinicians that provide very specific trauma-focused, evidence-based treatments. These are things like trauma-focused cognitive behavioral therapy. We also provide another very, unique intervention called problematic sexual behavior, cognitive behavioral therapy. And so we're able to support the child, and that we're able to get children in who come in because of disclosure very quickly without going through that 26 to 52, week wait.
Right.
In addition to that, we also, because of our partnership with the Massachusetts Department of Public Health and their pediatric sexual assault nurse examiner program, we have what's called a PD SANE on staff. So we have a nurse practitioner, so a mid-level practitioner. Her name's Erin Koshinsky. Erin is an amazing clinician, and she's a nationally board-certified pediatric sexual assault nurse examiner. And so when a child makes a disclosure, when they come in for a forensic interview, part of what we're also doing is looking at what type of aftercare services can we provide. And medical care is extremely important. And so because of the way that individuals make disclosures around sexual abuse, more often than not, we're not talking about someone who makes what's called a contemporaneous report. So they're making a disclosure shortly after it happens, in the hours or days after. Oftentimes it may be weeks or months or years afterwards. And so in those instances, the child may not necessarily need to go to the hospital for an acute care response, but nevertheless, we want to make sure that they're being seen by a specialist and a medical professional who can help kind of provide the type of care and examination to let the child and the family know that they're healthy, and to be able to rule out any other type of concerns that we may have. And if there are any, to be able to work with the pediatrician or other specialists to make sure that that care is being provided.
Well, I mean, you have to worry about sexually transmitted diseases, for one thing.
Indeed.
But also this stigma. I mean, how do you destigmatize it so that people don't feel, because victims often want to blame themselves, like, oh, I deserved this somehow. They feel a sense of shame that somehow they're the center of why everything's going wrong. Because, children, they're so self-centered in a way.
Well, and developmentally appropriate,
right?
And that's also what happens in the grooming process, where perpetrators, are making the child feel as though, that one, they're doing nothing wrong, two, that the child wants it or is enticing them, right? And so there is this tremendous amount of internalization that occurs where the child may question, well, what did I do wrong?
Right.
And so to answer your question, Drew, relationships, right? And that's what we do at the CAC, is we create these trusting, safe relationships with this team of amazing providers who are able to help support the child and the family as they navigate through this process. And so, to that end, right, we have a medical suite up on Wisdom Way where children and families receive the same quality of care here with the same credentialed providers as they would at Massachusetts General Hospital in Boston or at Boston Children's. And actually, because we're part of this DPH statewide program, that we actually have a board-certified child abuse pediatrician who does, a concurrent or an immediate review of any medical appointment where there's a concern. So the good news is that if a child needs to have one of these types of appointments, they can get the same quality of care right here in Greenfield as traveling all the way into downtown Boston. So mental health, specialized medical care. We also provide services around just victim advocacy. So we have two amazing advocates who work with families and accompany them along their journey.
Right.
And that one of the things that we're really set up to do is to provide time unlimited services. That in this current era where so many services are in what you can get access to is
your
dictated.
10 months are up.
Well, exactly, right? It's driven by oftentimes health insurance decisions, right? Do you have a prior authorization? Oh, we've only authorized so many units. You can, really the rationing of healthcare. We're able to provide services on a time unlimited basis. And so that means that we may meet someone and they may not be ready, and they can come back in a month, 6 months, or a year, right? And we're there. But it all kind of comes back to that relationship, and our child advocates do an amazing job with that.
How do you afford to do all this?
Yeah, so first I want to say we have absolutely tremendous support from the Franklin County community, and that, as I mentioned when we first got started, we were privately funded.
Right.
We also, the scope of services that we provided then is very different than what we provide now.
Right.
So initially, we receive a tremendous amount of support from this community, and we are profoundly grateful. In addition to that, we also have started to receive public funds.
Okay.
And so I really want to shout out kind of an organization and an individual in particular. So we are a member of the Massachusetts Children's Alliance, which is the association of nationally accredited CACs in Massachusetts. And they're the ones who are helping to advocate up on Beacon Hill, and that they actually help provide us with funding. So we get money through the Massachusetts Children's Alliance that comes to us through the state. But Senator Joe Comerford, right? I mean, Senator Comerford is a tremendous advocate for children. I think for all of us, we all know that. But one of the things that Senator Comerford has been a staunch advocate for is child advocacy centers and equity. Right, and when I say equity, what I mean, and again, I don't think I'm speaking out of turn, right, that we in Western Massachusetts receive disproportionate levels of funding to our colleagues across the state, especially those within the 95 Beltway. And one of the things that Senator Comerford, since she's moved into a leadership role on Ways and Means, has been a staunch advocate, is making sure that all children have access, to a child advocacy center. So we've actually seen some increases in public support because of her leadership, and that we're in a position to be able to help more kids because we have stable funding and because we're not out having to fundraise, for absolutely everything.
Well, and the thing is, ultimately, I have to feel that it's going to save our community money by taking care of these children before they then go on and engage in the same kinds of destructive behaviors, because there's a cost there.
There sure is. And and beyond the macroeconomic kind of conversations, right? That these
don't we want a healthy people?
We do, right? I mean, and that we want safe and healthy children. Childhood is such a profoundly important time, right? This sets the foundation for the rest of our lives, and that we really want to be able to, one, prevent these adverse childhood experiences before they occur, but if they do occur and when they do occur, we want to make sure that we are there to provide a trauma-informed and a trauma-responsive response to that child to help support healing and recovery. Children are profoundly resilient. However, these are egregious crimes and profoundly traumatic things that occur. And we need to make sure that we can provide the right support and the right intervention in a timely way. So as I mentioned before, we've been very focused on mental health services, and that over the course of the past year, we have really expanded the amount of services that we provide. And again, that's because we've been able to hire expert practitioners who are doing amazing work each and every day in our community. Again, 9 years ago when we opened our doors, we partnered with an amazing clinician in South Deerfield who essentially we contracted with to be able to refer 4 of our children. Now, the CAC has seen on average 120 children a year who are reporting that they are a victim of child sexual abuse. So 4 is great, but it's not enough. Right. And that now we're to the point where we provide 30 outpatient visits on Wisdom Way a week. Right, and so the amount of children that we're able to work with has increased dramatically, and at the same time, we are also, kind of in the image of DA Sullivan, really focused on making sure that we can provide accessible and timely care. And so what that means for us is that one of the big initiatives that we're embarking upon this year is that we are opening a mental health outreach center in the North Quabbin, specifically in Orange. And so we have opened a group psychotherapy practice within the CAC over the past year, and that's just a fancy way of saying that we can now bill health insurance for certain services. Now, let me be clear, a family will never pay $1 to receive services from a child advocacy center. but I will charge Mass Health.
Right.
I will.
Right.
And that we are contracted with Mass Health so that we are able to bill for certain services. And when folks say, well, why are you doing that? I mean, for us, that means for every dollar that we can bring in through Medicaid, that's another dollar that comes in through fundraising or through other contributions that allow us to fund something that can't otherwise be paid for.
Seems like a no-brainer.
I think it's a no-brainer, and it's really kind of opened kind of our doors to the North Quabbin, and so we're really excited that we are partnering with the Community Health Center of Franklin County, and that we've moved into their healthcare plaza at 119 New Athol Road in Orange.
Okay.
And so we have a suite that's currently in the process of being renovated by Thayer Street Builders, and that we anticipate that that'll be open by the end of the calendar year. I'm really hoping it'll be open by Thanksgiving.
Right.
But really that's going to be a place where we're going to provide straight outpatient mental health care. So individual counseling, family therapy, group therapy, support groups for parents who have children that are victims of child sexual abuse. We really want to make sure that individuals who are North Quabbin, kind of brothers and sisters, that they have the ability to come to these services, which oftentimes are once a week or more. But for families to make the trip out to Greenfield, that's a real hardship, especially for parents that might be a single parent, are working multiple jobs, have multiple children, right? We want to make sure that that service became accessible. And so that's why we're really focused on having a brick and mortar presence in the North Quabbin.
Now, for our audience, is there anything that they can do to help you?
Yeah, so number one, we want to help get the word out. Right. So I'm so appreciative and grateful, Drew, for you inviting me here this morning. Secondly, if someone sees something, we want them to say something. And so most importantly, right, that, I want to say children, right, I believe children. Right. Children don't lie. And, I shouldn't say that. I just shouldn't say that as a,
but still, right.
As a parent, of a young child, and take the doctor away from my title. But, generally, I believe children, especially when it comes to saying that something like this has happened to them, right? Generally, kids don't lie about being victims of child sexual abuse. So we want to believe kids. Right. And we also want people to know that we and our other partners that are out there are there to be able to support kids. Also, right, we want people to know that we have an amazing event. And so, one of the things that kind of introduced us to the Franklin County community was our annual Hope and Healing Breakfast. Every fall, we have this amazing event. This year, it's going to be on Friday, September 13th at 7:30 in the morning at GCC. And it's really an opportunity for us to be able to share our mission of help, hope, and healing with the community, to be able to talk about and to share some of the outcomes, and to be able to hear from survivors about the impact of the work that they've done. And at the same time, we also, as a nonprofit organization, our lifeblood is the community, and that we're able to do creative, kind of innovative services and to provide the type of care that families need because of the generosity of community members. Right. Those unrestricted donations that come in that allow us to buy gas cards or to help supplement other types of social service programs, especially in this hyperinflationary environment, that aren't able to go far enough for us to be able to help support our families. We rely on the generosity of the community. So we would welcome anyone who wants to support us to come to that breakfast. We also know that that's oftentimes in the middle of folks' work day. And so folks can also check out our website, cacfranklinnq.org, if they'd like to learn more about the Children's Advocacy Center or if they'd like to support our mission.
Very good. Jeff, I appreciate you so much coming on the show today. This topic, unfortunately, isn't going to go away. It's not going to be, we're not going to heal everybody overnight. But the fact is, progress is being made. We understand more now about childhood and early adolescent mental health than we did before. We know we're developing better practices. Progress is being made. And I suppose my question is if someone was interested in becoming a clinical social worker, specifically dealing with these types of issues, do you have a recommendation for them?
Yeah, so I guess I want to start by saying we need more people with lived experience in the field.
Oh, okay.
Right? So, that moving forward, the human service professionals and professions across the board, whether we're talking about medicine, whether we're talking about clinical social work, psychology, so on and so forth, we need more people going into the field, and that we need more people with lived experience. That's absolutely, just integral. In addition to that, I also want to say how important it is that we continue to have individuals who are representative of those who are served within the workforce, and that we have no better partner than those at Greenfield Community College that are really beginning to, to help people gain entrance into the workforce. So whether it's, attending, and earning an associate's in arts in human services, and then transferring to a school to be able to get a 4-year degree, and then on to a master's degree. Right. There are a tremendous amount of resources that exist right here in our community, and that GCC and our community colleges are an amazing partner, to really help build a strong foundation.
Very good. Well, thank you once again for coming on.
All right, you're very welcome.
I'm Drew Hutchison. You've been tuned to Local Bias. My guest has been Jeff Trant of the Children's Advocacy Center, CAC, as you like to call it. And I encourage you to check it out. I'll put up the information in the closing credits and maybe a little bit along the bottom there. Thanks for joining me. Take care.